Hello, glowing humans, and welcome back to the show that keeps finding new and scientifically grounded ways to explain why your skin looks tired and what to actually do about it. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is going to reframe everything you think you understand about the word glow before this episode is finished. Dr. Lazuk is not with us today because she is currently inside a photobiomodulation research facility outside of Helsinki, Finland, having accepted an invitation to evaluate a clinical study on wavelength-specific cellular response in compromised skin barriers. She arrived for a scheduled 4-hour visit. She has been there for 3 days. The research team reports she arrived with focused curiosity and has since generated what they describe as an unreasonable number of extremely good questions about mitochondrial response to near-infrared at varying tissue depths. She has also reorganized their entire wavelength efficacy data by inflammatory origin, which they initially questioned and have since described as the correct way to have organized it all along. She is currently reviewing results from a second cohort. We have made peace with her timeline. So, you have the avatar. And today we are talking about something that sits in an interesting space in skincare. Genuinely effective, clinically grounded, consistently undersold because its results do not arrive dramatically enough to satisfy before and after photography. LED therapy and why it might be exactly what your skin has been missing. Let us start with the word people use when they cannot quite articulate what is wrong: glow, or more accurately, the absence of it. Skin that looks tired, flat, uneven. Not unhealthy in any specific way you can point to, just not alive the way it used to be. And the confusing part, for many people experiencing this, is that they are doing things right. Cleansing, moisturizing, protecting from the sun, even treating with actives. The routine is solid, and yet something is still missing. That something is usually what Dr. Lazuk describes as recovery capacity. And it is where LED therapy enters the conversation in a way that most other treatments simply cannot. Here is what is actually happening in a lot of modern skincare routines. People are very good at the intervention side of skin health. Exfoliation, resurfacing, correction, active ingredients that produce visible change. All of those tools can be genuinely effective. All of them also require the skin to heal well afterward. And healing well requires something that aggressive routines frequently do not leave room for: adequate recovery time and cellular energy to complete the process properly. When recovery is rushed or incomplete, when the skin is asked to do the next thing before it has finished responding to the last thing, it does not look radiant. It looks dull, flat. It is working hard but falling behind. Because it is. The stimulation is happening. The recovery is not keeping pace, and glow, it turns out, lives on the recovery side of that equation. LED therapy supports recovery, not by adding another demand to the skin's already full agenda, but by providing light energy at specific wavelengths that help cells perform their existing jobs more efficiently. Now, let us be precise about what this means, because LED therapy gets both oversold and undersold depending on who is describing it. The science underlying it, photobiomodulation, is real and well established. Specific wavelengths of light interact with specific structures within skin cells, primarily the mitochondria, supporting energy production, reducing inflammatory signaling, and encouraging repair processes. No heat, no injury, no recovery time required. The skin is not being wounded into responding. It is being given energy it can use to do what it already knows how to do. Red light wavelengths support collagen activity and reduce inflammation. Blue light wavelengths address the bacteria involved in acne and calm associated redness. Near infrared penetrates more deeply, supporting healing and circulation at levels topical products cannot reach. Different wavelengths, different targets, but a shared underlying logic, supporting cellular communication rather than overriding it. This is also why the experience of LED therapy so frequently surprises people who are expecting something more dramatic. You sit in front of the light. Nothing feels particularly intense. No tingling. No heat. No sensation of correction happening. And then you look in the mirror and your skin seems calmer, more even, less reactive than it was an hour ago, not transformed, just quieter and more cooperative. That quietness is the point, and it is where the value lives. Over consistent sessions, and consistency is genuinely non-negotiable here. LED therapy is cumulative rather than immediately dramatic. Something more visible begins to develop. Inflammation that was creating subtle redness and unevenness settles. Texture refines as cellular turnover becomes better supported. Fine lines soften slightly as collagen activity improves. And the skin develops a quality of radiance that is distinctly different from the temporary brightness that follows an aggressive peel or a heavy highlighting product. This is the glow that comes from the inside of the skin outward. Cells that are performing efficiently, managing inflammation well, and maintaining hydration properly. Not a surface deposit of light, actual light reflective behavior from skin that is functioning correctly. Dr. Lazuk values LED therapy for a reason that goes beyond its direct effects. It is a tool that genuinely makes everything else work better. When inflammation is reduced and cellular energy improves, the skin becomes more receptive. Active ingredients penetrate more effectively. Recovery from other treatments accelerates. Results from procedures last longer. The whole system becomes more cooperative because the recovery side of the equation is finally being supported as consistently as the stimulation side. This versatility is also worth noting directly. Acne-prone skin benefits from inflammation reduction and bacterial management. Aging skin benefits from collagen signaling support. Sensitive and reactive skin benefits from the quieting of inflammatory pathways that are keeping it in a permanent state of low-level alert. Post-procedure skin benefits from the accelerated healing that reduces downtime and improves outcomes. And skin that simply looks tired despite a solid routine benefits from the cellular energy support that gets recovery moving again. No peeling, no burning, no barrier disruption. In a landscape full of treatments that ask skin to tolerate discomfort in the name of results, LED therapy offers improvement through support rather than stress, which, if you have been following this entire series, you now understand is not the gentle compromise it might sound like. It is biologically the more intelligent approach. Here is what Dr. Lazuk tells patients who are wondering whether something this undramatic can really produce meaningful results. Glow is not something you apply. It is something your skin produces when it is functioning well. Highlighter creates a surface approximation of it. Aggressive treatments can temporarily stimulate it, but genuine, sustained, consistent radiance, the kind that makes people ask if you have been sleeping better or just got back from somewhere beautiful, comes from skin that has adequate cellular energy, resolved inflammation, intact barrier function, and the recovery capacity to process everything it is being asked to do. LED therapy helps create the conditions for all of that. not by forcing the skin toward a result, by restoring the internal environment that makes the result possible. That is not chasing brightness. That is restoring vitality. And when the skin feels genuinely supported rather than constantly pushed, radiance follows as naturally and as inevitably as it did when the skin was young and its communication pathways were clear. Consistency is the commitment it requires, the patience to let cumulative improvement arrive on biology's timeline rather than marketing's, and the understanding that the absence of drama during treatment is not evidence that nothing is happening. It is evidence that something is happening correctly. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice or a clinical recommendation for your individual skin situation. LED therapy protocols, wavelength selection, and treatment frequency should be discussed with a licensed professional who can evaluate your specific skin and goals. Please consult a qualified dermatologist for personalized guidance. Dr. Lazuk will be available for consultations as soon as the Helsinki photobiomodulation data set releases her and someone confirms a departure time she will actually honor. May your skin always glow as brightly as your smile.